Hi, my name is Michelle Vong Ober, and today I'm going to be talking about journaling in new graduate nurses for Colorado State University Pueblo with Dr. Peg Rooney as partial fulfillment of the oral comprehensive examination. My PSOT question is, does reflective journaling for 6 months improve a new graduate RN's patient care? The P stands for population, which is new graduate RNs. The S is strategy, which is reflective journaling. The O is improving patient care, and the T is time frame, which is within 6 months of graduation. The significance of the problem is that being a nurse is a lot of responsibility, and being a new nurse is very intimidating. Oftentimes, new graduate nurses go into the nursing world into many very challenging, difficult units, such as the ICU, the emergency room, or the PACU, which requires a lot of critical thinking skills that nurses are expected to have right off the bat as soon as they graduate. Why this is important to advance nursing practice is, as a future nurse educator, we want to create successful, amazing nurses. And the only way to do this is to set our nurses up for success. The nursing profession must implement ways to set up nurses to succeed. And this is through nursing residency programs, mentors, and journaling. Nurse residency programs are programs that new graduates must enroll in when they enter the nursing world, and this gets them more educational classes, mentors, and more support to help them succeed. Mentors can help foster a very healthy nurse-mentor-mentee relationship so that the new graduate nurse can go through situations that they might want to debrief on. They can ask questions. They can go through how to improve their skills. They can talk about how to reduce burnout within their profession. These are all appropriate questions and situations to ask your mentor, and that has shown to improve success. Journaling has also been shown to set the new graduate nurse up for success by helping them reflect and learn their critical thinking skills. We'll talk more about the benefits of journaling in the next slide. Journaling has many benefits. It can help reflect, promote critical thinking skills, help inquiry, self-teach, and help reduce burnout. Reflection is the process of going through different scenarios or situations that may need some further thought. Nurses can reflect on what went well, what could be better next time, and what they have learned from this. Going through these questions helps promote critical thinking skills and helps deepen nursing knowledge and can help improve patient care the next time. This can also help inquiry, which is asking what can we do as nurses better? Can we get the doctor here faster? Can we push harder and advocate for our patient care to help improve patient care? Can we, those are kind of questions that can be inquired after you reflect, and this is done through journaling. By asking these questions, you're also self-teaching yourself. You can look up kind of different medication adverse effects. We could kind of know more about medications and kind of be able to advocate more for our patients. We could know more about a certain topic, and that way we can deepen our knowledge and be able to advocate for our patient better, or know the rationale behind why a doctor may have chosen one route over the other. There's so much that nursing can expand on, and the more we know, knowledge is truly power, and this can help improve our patient care. Journaling can also reduce burnout and keep amazing nurses in the profession for longer. And this is really important because burning out is such a huge portion of nursing today, and it's all about reducing burnout. And so journaling can also help foster all of these benefits. The evidence-based teaching is showing is that we are learning through clinical learning. This is through simulation, clinical, and nursing senior practicum, which are all opportunities for students to do things instead of just sit there and absorb information. In traditional settings, education means lectures and PowerPoints and having someone teach you what you need to know. In today's education system, the evidence-based teaching is showing that there are other techniques such as clinical learning so that the students can do things and practice things, and that is effective learning as well. Through clinical learning, students learn how to convey theoretical knowledge. They are using what they know and they are applying what they know. They are practicing their nursing skills. They are developing interpersonal skills and interactions with others, and that's important for them to practice. They are also learning how to advocate for their patients and their family members, and they are acquiring the necessary competencies to be able to become an extraordinary nurse. This article that I found was studying how research papers and reflection was able to help students reflect on their skills. After the study was done, it showed that when undergraduate nursing students are expected to reflect, they were able to help their own learning, identify their strengths and weaknesses in their work, help facilitate development of autonomy. They were able to think more open-mindedly, and they were able to critical think. And these are all important skills that nursing educators want their nursing students to be able to learn and foster that type of learning on their own. The next article studied gratitude journaling and cognitive strategies and how it helps mental well-being in healthcare workers. The study showed that the participants who were registered nurses and advanced practice registered nurses helped decrease the depression and anxiety when they were able to practice gratitude and journaling and cognitive strategies in healthcare. The study that was done among emergency department new graduate registered nurses, and they were able to go through a pathway practice to help transition them from new graduate nurses to becoming novice nurses. And after a nurse residency program that required journaling, they were able to help their turnover rate because these nurses felt more supported and felt like they had more knowledge and a deeper toolbox. They felt that their retainment would increase, and that's exactly what happened. And because these nurses had ACLS classes, education classes, continued education, and coaching, they felt more supported, and they felt like they were able to stay where they were at because they were happy there and felt supported, and that's exactly what we want for our new graduate nurses. Research implications for the advanced practice nurse when it comes to this topic, but nursing educators can first do research for the university, and they can also research among their students and determine what their likes are versus their dislikes. This is important for a nurse educator to do because it's important for us to assess what works for our students and what doesn't. We can apply these evidence-based teaching resources to our students and to healthcare and to benefit our patients. It's important for educators to advocate by highlighting the importance of self-care, reflection, and self-awareness within our educational learning and within our nursing practice, because we want our nursing students, but our new graduate nurses and our experienced nurses to be able to reflect and self-care for them after their emotionally exhausting, mentally exhausting shift. And so we want this habit to come from a young age, which is nursing school. There are gaps within the study, and sometimes this can include like a specific student population. When we're studying like nursing students and their habits, it may not include kind of like if their program was fast track or if it was traditional. And they don't always specify what kind of nurses. There was one study that said emergency room nurses, but not all studies are specifying what kind of nurse, and they're generalizing it, and that may or may not have an impact. Some of the studies were done with a smaller study population, and that can be expanded. Some of the studies were done with like one hospital, and that can also be expanded. And generally the size of the cohorts varied, and so that's another gap in this research project. Why this is so important as a nurse educator is because nurses are a critical part of healthcare. There are approximately 3.9 million nurses in the United States, and there's still a need for nurses and a need for good nurses to emphasize. There is a nursing shortage due to many factors that include nurse burnout and a smaller working generation and an aging population, which is known as the baby boom generation. The baby boom generation is the highest number of Americans over the age of 65 than any other time in history, and therefore there needs to be a working population to be able to care for these older adults. There are ethic policies that are relevant to this nursing practice, and they include beneficence and justice. Beneficence and justice are required to provide to our nursing students within the education system so that they are becoming successful nurses. Beneficence is defined as the act of charity, mercy, and kindness with a strong connotation of doing good to others, including moral obligation. As educators, we owe it to our students to give them the knowledge to be successful nurses. Justice is centered on maintaining obligation, equity, and fairness throughout the application of moral principles, rules, and established standards. So we must give them the materials that they need to know and give them the direction that they are required to be successful, and that's justice and fairness. Technology in teaching includes having the students submit online journals. This can be through discussion posts and having the students respond to each other in order to foster critical thinking skills and foster reflection. Or they can do this through a traditional journal log and having them write their entry and write their thoughts down. Teaching practice guidelines includes having these students submit a journal entry, and this can include questions that can help foster their thinking. The questions that I have chosen are: how was your experience? What did you enjoy about your learning? And what do you think you need to work on? And from there, the students can expand as much as they would like to on their experience in hopes that they are inquiring, reflecting, and promoting critical thinking skills. The NLN Novice Nurse Educator competencies include competency number 1. This is facilitating learning. It is implementing a variety of teaching strategies appropriate to learner needs, desired outcomes, content, and context. Competency number 2 is facilitating learning development and socialization. This includes recognizing the individual learning and professional socialization needs of diverse populations. Competency number 3 is using assessment and evaluation strategies. Competency number 4 is participating in curriculum design and evaluation of program outcomes. These are all important competencies to keep in mind when we are educating our students on how to become amazing, extraordinary nurses. Essential domains and core competencies of the novice nurse educator includes domain number 1, which is knowledge for the nursing practice. This includes translation to help patients and their families understand medical literacy. This is something that healthcare needs to be aware of, is because not everybody has medical literacy. And so using more common language in explaining and describing the medical condition is very important for nurses to be able to do. They can also integrate nursing knowledge and apply them to benefit patients and their family members. There was a study done in Northern California on new graduate nurses in the post-anesthesia care unit at an acute care hospital. The result of this case study showed that when the new grads followed a training program, they grew from a novice nurse to an advanced beginner very successfully. At the end of the program, the new graduate nurses completed a knowledge assessment encompassing everything that they had learned within the peri-anesthesia department, and both new grads passed their assessment successfully with high scores. This program also included journaling, and they were receiving feedback from their peers, and the feedback had been extremely positive. The new graduates have adapted to their environment and they utilized their new skills, and they were well on their way to becoming a very advanced beginner, which is exactly what nurse educators want to see after nurses complete the program and after they transition from a new graduate nurse to a working RN, is exactly this. And so there was success when nursing set their students up for success, and that is the goal of everything. Educational theoretical framework behind this includes the cognitive learning theory. This is when people build knowledge and our students have active student-centered focus, and their focus is on building, linking concepts within the nursing practice. The cognitive apprenticeship includes the students with the experts, and this is the preceptor-preceptee relationship. Preceptors are expected to utilize their teaching strategies, utilize learning strategies that work for the student, and each student is different, and the student is able to advocate for themselves and explain what works for them. And it's including integrative learning experiences. So that means like the preceptor showing the student what they need to see if they haven't seen it already, and kind of showing them, teaching them, and explaining all of those concepts. That can include and entail so much, and that's going to help that student learn the most and just improve their experience. Leadership is certainly required in education, and this means making education meaningful, memorable, and worthwhile. And when nurse educators want to foster that type of environment, the nursing students are often reciprocal to that, and they are appreciative of that educator wanting to make that experience a very worthwhile time. Leadership can include asking and providing input to seek and change out relationships with students, but educators also need to demonstrate a professional integrity with students. This can include advocating for student learning. It can include inquiring more from the students, and it can also include valuing students' opinions with their own education, which is very important, because when a nurse speaks up about their education, we want to take their concerns seriously. Marie, it is important for the nurse profession to help new graduate nurses feel supported, and this can be done through journaling, and it is important to continue to help nurses feel important and prevent burnout. So this doesn't just apply to new graduate nurses, it also applies to experienced nurses as well. The evidence shows that after nurses have developed their own way to cope and reflect after a shift, they can learn more and improve their nursing practice. And journaling at a young age in their nursing career is important to being able to take that on as they further their career. At the end of the 6-month program of reflective journaling, the new nurses stated that they felt like their patient care improved, and as they journaled more about their experiences. The hospital educator recommended to nursing administration that the journaling program can be required for all nurses, and that is a success. The references that I have used for my PowerPoint slide. Thank you everybody for listening and watching my presentation PowerPoint.